Hello, welcome to InSight. I'm Wendy Brokaw. As of July 16th, there is a new, easy-to-remember number for people who are suicidal or experiencing any kind of mental health crisis or are worried about a loved one who may need crisis support. They can call or text 988. 988 is a new 3-digit number for the National Suicide Prevention Lifeline, which is now active across the United States and available 24 hours a day, 7 days a week. 988 is a huge change in the way we're delivering mental health services. And where is Oregon in the 988 process? What can people realistically expect from it right now? And what resources does it connect them to? And how is it supposed to operate optimally somewhere down the road? For insight into that, I have invited a guest, Rusha Grinstead, Behavioral Health Crisis System and 988 lead for the Oregon Health Authority. Hello, welcome, Rusha. Thank you for joining us.
Thanks, Wendy. So 988, it is a 3-digit phone number that is replacing the 10-digit National Suicide Hotline as we had known it in the past. The advocacy to create a 3-digit easy-to-remember phone number has existed and has been going on for a very long time. And then in 2020, October of 2020, a federal legislation was passed to turn the 10-digit National Suicide Hotline to a 3-digit easy-to-remember phone number, which is 988. The other critical thing that federal legislation did was to expand the scope of that phone number to not just those who need help for their mental health during a suicide crisis, but also for any behavioral health crisis. So it is not just geared towards those who have suicidal ideation or those who are experiencing suicidal thoughts, but also if you're experiencing any kind of behavioral health crisis, if you're seeking help for your loved ones, your friends and family who might be experiencing behavioral health crisis or behavioral health related stress and emotional distress, you're able to reach out to 988 and get connected to a trained crisis intervention specialist who will provide you with crisis intervention and de-escalation services from the moment you call.
It sounds ideal because so many people these days keep doing what they've always done, which is to call 911, and that involves law enforcement. This is designed to not replace that, but be something that is more effective.
Yes, so Wendy, when it comes to 911, the goal for 911 is to be able to dispatch first responders when individuals are seeking that kind of service. With 988, the expectation and the purpose is that the moment you call this phone number, you're immediately starting to receive services for behavioral health, with the goal that you receive a behavioral health response to your behavioral health crisis. So you're always talking to a trained crisis intervention specialist who is providing you with de-escalation services. And if you need further services, even after the call, you are able to get connected to those in your community, from providers in your community, and then making sure that you are able to take care of your mental health and you're able to cope with the mental health crisis you're facing at that very moment.
Where's the money going to be coming from for this? It's a federally mandated service, and there has to be a way to finance it. And many states are not anywhere near as far along in their process of implementing 988 as is Oregon.
In Oregon, Wendy, we did pass a legislation in 2021 where Oregon legislators invested $5 million into the 298 call centers that exist in Oregon right now. On top of that, the Oregon Health Authority has invested some more federal funds, which were specifically deployed to states by our federal partners to get ready for 988 and to meet the capacity that is needed. So that's where in Oregon, we are receiving funding to start up our 988 call centers.
So many people are suffering. Young people, suicide is the number 2 killer of young people between 10 and 34. And the need is dire. So ideally, can you tell me how this situation would work so that not only are people trained to handle all kinds of calls, including suicide prevention, are able to route these people quickly? Some calls lines keep you waiting, and that's one thing that needs to be avoided in those circumstances. Would 988 do that? Keep you waiting?
Absolutely not, Wendy. There are federal standards that all 988 call centers are required to meet. And in Oregon, in the first weekend when 988 went live, Oregon has actually exceeded that federal standard. The federal standard states that all 988 call centers should be able to take 90% of the calls in state with no longer than 20 seconds of wait time. And we are already meeting and exceeding that standard. And we will continue to work with our 988 call centers to make sure that we are giving them the support they need to maintain that capacity. As Oregon was gearing up for the go live date of 988, both of our 988 call centers have added over 70 new staff to their call centers. So we are staying prepared for the increased call volume and the capacity that's needed to meet that.
All right. What kind of resources will it connect people to right now? And what do you hope for? What can people expect in the way of resources?
988 should be able to connect individuals and families to both community-based resources as well as resources that are able to provide face-to-face services during a crisis. As you will hear from our 988 call centers at some point if you talk to them as well, is that over 90% of the calls that come to 988, they usually get resolved and de-escalated over the phone. Those individuals are still connected to resources within their community, such as 211 and other kind of community-based resources where individuals can continue to get support and have better skills to be able to prevent a future crisis. For those individuals and families who call 988 and after speaking with a trained crisis intervention specialist, if they still need more help and support at that very moment, 988 will connect individuals to behavioral health crisis resources such as mobile crisis services, which comes to an individual where they are at and provides crisis screening and assessment, and again, connects individuals to services within their community and with providers who are in their community to make sure that the individual and the family receives the appropriate service they need and also the appropriate services that they want to be able to access.
Go into that a little bit more, would you? The services that they want. That sounded important to you to get across what that means.
Yes, so Wendy, for anyone who is calling 988, we are always going to make sure that 988 is providing individuals with crisis intervention, but at the same time, they are also making sure that it is person-centered and family-centered. So the kind of resources and the kind of services an individual or family expresses that they want to access, 988 call center staff will connect them with those services as well as provide them with resources which will make sure that they can access those services within their community.
I understand that's one of the big goals of 988. It is to get people the immediate help they need with someone who can help them, and then a place to go, and then the care they need to follow up. Am I right?
That is absolutely right.
All right. Tell me a little bit about the integration that this will have, if any, with law enforcement. Many people are afraid that if they call 988, they'll be hospitalized right away. Is that true or not?
So, Wendy, like I mentioned, with 988, the goal is that individuals receive behavioral health response for their behavioral health crisis. And the goal is not to dispatch first responders. The goal and purpose of 988 is to start providing crisis intervention services to an individual or family who calls 988, and then connect them with appropriate behavioral health services that they need and want.
All right. Now, you're deeply involved in getting this lifeline, as it's called, set up and working in Oregon. That means having to go to many different people and making sure that distant people in Oregon know about it. How are you getting the word out?
We are working with our communities since the very beginning of this whole planning process, and we're continuing to do so, especially our rural communities and communities who have experienced adverse impact of trying to seek behavioral health crisis services, making sure that those communities who have been historically marginalized are able to access the resources and the services they need. And we continue to work with them to make sure that we are designing our communication with the community and led by the community.
That's quite a step forward. This is such a huge transition in behavioral health management and care, and it's like a mindset shift, is it?
Absolutely. You know, Wendy, for a lot of individuals and families, the behavioral health crisis system is the first door through which they even start accessing behavioral health services. So we want to make sure that whenever somebody is experiencing a behavioral health crisis, they have access to those behavioral health response, which is the initial crisis de-escalation, and then being connected to long-term behavioral health services so that they can prevent a future crisis.
All right. Very quickly, can you tell me, how does it work? In other words, just the function 988. Somebody says, okay, crisis 988. How do they call that number?
Absolutely. So if someone calls 988, they will receive two options. If they press 1, it will connect them to the Veterans Crisis Line. And if they press 2, it connects them to the Spanish-speaking 988 line. And if they choose neither, then they are connected to a live trained crisis intervention specialist who is working in the 988 call center. One can also text 988 and also chat with 988 through the 988.org website.
How many languages are able to be accessed? How can people speak in their own languages? Are you set up for that yet?
We do require our 988 call centers to be able to provide interpretation services. And as a by default mechanism, like I mentioned, if you press 2 when you call 988, you can speak with a Spanish-speaking representative.
How long do you think it's going to take for this system to be fully integrated and up and running? What do you think?
We are continuing to work with our communities, and this is an ongoing process. And what we are really wanting to make sure that the system that we build is led and guided by the communities who are using these services, especially those who have had the hardest time accessing behavioral health services. Some things take a little bit more time, but but a lot has already been done as well. And we just want to make sure that as we build this system, it is truly addressing how our communities want to experience behavioral health crisis response.
Given your experience, just how good do you think this change is overall?
I think this is definitely a change in the right direction. And especially in Oregon, we are designing the whole system, making sure that those who we are designing it for are the ones who are helping us design from the very beginning with them. So we are really, for every step, we are really working with our communities, taking their guidance and how we can create our policies, how we create all of our rules around 988. It's all absolutely guided by our communities who are using these services.
And when it comes to law enforcement, well, how have you been involving them? Because this is also a change for them. They're not going to be the first responders necessarily. How are they being prepared to adapt to 988?
Yeah, we have a work group which consists of Oregon Health Authority and also all of our 911 partners who work very closely with their within their community with law enforcement as well. And we are really working with our 911 partners to again design how 988 and 911 can coordinate between each other. So we are making sure that all of our community partners and communities using these services, they're all coming to the table together.
And are they appreciating this whole new system as well? Do they think this is a good change?
I think across the board, the entire nation, the entire state thinks that this is a change in a good direction. To have more access, this essentially increases access to behavioral health services for the entire population. So yes, absolutely. I think everyone thinks this is a change in the right direction. We just need to work with our communities and the partners and providers who deliver these services and continue to do that work to make sure that we are building the system that works for everyone.
Where can they go for more information from you?
There is an OHA webpage for 988. There is more information available there as well, and also on lifeline.org, where there is a lot of information available about 988.
Thank you. We've been talking to Rusha Grinstead. She is the Behavioral Health Crisis System and 988 lead for the Oregon Health Authority. This has been illuminating. That's exactly what I hope we might be able to get, more understanding of 988. Thank you for joining us today, Rusha.
Thank you, Wendy.
And thank you for joining us today. I'm Wendy Brokaw. This has been InSight. Thanks for joining us. If you or someone you know is having thoughts of suicide or experiencing a mental health or substance use crisis, 988 provides direct connection to free, confidential, and compassionate support. When you call, text, or chat 988, you'll be quickly connected to trained crisis counselors who will listen to your concerns, provide support, and connect you to additional resources if needed. There is hope. The Lifeline works. You are not alone in crisis. For 24/7 confidential support, just call, text, or chat 988.